senators to roll in. So Patty's here. Thank you very much, Patty. Appreciate you being here. All right, so we're going to start with Senate Bill 1024. Whose bill is that? Well, maybe she's not here.
Okay.
Who's 1499?
Mosley.
Is she here?
She's in the elevator.
Okay.
Representative Chappell's here if we want to.
Representative Chappell, thank you for being here. We're going to start with you, buddy. Senator Gregory, you're up too. You guys are doing this together? 1137?
Oh, no. Those are two different bills.
So Curtis Gregory?
Yeah.
David Gregory. Senator, Representative, oh, that's good. That would make it good. Go ahead. We'll go ahead and give, since he's here, Representative Chappell, begin when you're ready.
Thank you, Madam Chair and Senators of the committee. My name is Darren Chappell, and I am a state representative for the 137th District in Greene County. I appreciate you hearing on HJR154, which is the Medicaid work requirement bill. This bill mirrors that which is put into effect on January 1 of 2027 by HR 1 from the national government. And I believe this is good policy, and I would like for it to be enshrined in the Missouri State Constitution as well. The Missouri State Constitution currently does not allow for work requirements on Medicaid, but HR 1 obviously supersedes the state Constitution. This would simply make the changes that are going to be going into effect regardless into effect permanently. It requires a work requirement for all individuals ages 19 to 65 who are able-bodied, and they would have to work 80 hours a week, or a month rather, 80 hours a week, 80 hours a month rather. Yeah.
Thank you.
So 80 hours a month, or 80 hours of community service, being involved in a work program, or being a half-time student, or any combination thereof. It is required that they have that work requirement met for the month prior to them being able to receive benefits, and there is no self-attestations allowed, so it'd be documented by the Department of Social Services. As I said, this is going into policy on January 1 of 2027, regardless of what we do here. However, I'm told that the Department of Social Services believes that this will save the state $300 million the first year, $600 million every year thereafter. And if you'll allow me just for a moment, just a little bit of personal reference. I am the chair of the subcommittee in the House for Health, Mental Health, and Social Services for the appropriations thereof. I worked really hard to make sure that the SDS children in our state received the funding that they needed. It was $86 million that I had to find in a budget. You would think in a budget of $54 billion, I could find $86 million relatively easily, but it was extraordinarily difficult. And
Are you referencing some of the self-directed services?
yes, ma'am.
Yeah, thank you.
And I cannot tell those children that their funding is at risk while we continue to allow able-bodied adults to draw Medicaid with no requirement of trying to work themselves out of the system. And so this bill was brought to the floor in the House. It passed. And we now sit before you and await your questions.
Thank you, Representative. Just a quick question. Does this have anything in regards to taking care of any of those special needs kids if they were?
No, ma'am. This is simply a question of following the national law and making sure that we have the wherewithal and the budgetary flexibility to be able to make sure that these dollars go to those individuals who are the most vulnerable among us.
No, I appreciate that. I filed a piece of similar legislation in prior years, and there was something related to if you were home taking care of a special needs child or something that was classified as work. I didn't know if that had this had the same exemption or any language reference to, because just like you said, those people are taking care of those kids. That kind of is their work. I just didn't know if it was addressed in this.
It's not. I would be open to that discussion, obviously. The goal of this is not to hurt anyone.
Oh, I understand.
And I'm not trying to, but I do find it extraordinarily difficult to have people whose very lives depend upon the capacity to have the care that the state provides, and have that be at risk year after year after year. Medicaid expansion, when it was passed by the voters, did not identify a funding source as the Constitution allows, that it must. Frankly, I think the Supreme Court should have struck it down. They didn't, and we are now where we find ourselves.
Is there a way to add something? I mean, has there been any conversation in fixing that if this goes back to the vote of the people?
No, ma'am, but if the Senate would like to alter it in that way, I'd be supportive of it, and I feel confident we could get that through the House.
Okay. Yeah, just a couple of questions that I had. Any other questions for the representative? Seeing none. Oh, thank you. Senator Lewis?
Good morning, how are you?
I'm well, Senator. Yourself?
I'm good, thanks. I'm looking at the fiscal note, and I think you said something about a savings, so that's not reflective in the fiscal note. It's a zero fiscal impact. So can you elaborate on what details of the savings that you mentioned?
Yeah, because this is already going to go in effect by H.R. 1, the savings that are going to be seen from that were not included in this fiscal note. The fiscal note reflects $9 million, and it's because if the governor were to have a separate election, which I do not anticipate the governor having for us. So the savings of the policy are wrapped up in H.R. 1, which is already going to go in effect on January 1, so they're not reflected in this fiscal note.
Okay, and then you said I guess, can you please describe the documentation required for someone with cancer or a chronic condition would look like?
It would just be a doctor form that's filled out that says that they're incapable of fulfilling the work requirement, and it would be handled through DSS.
And they have to do that monthly?
No, ma'am. Once they're done in that regard, then if it were to change, it would be their responsibility to make sure that DSS knew that. But assuming that their condition is of a more permanent basis, then it would not have to be done monthly.
Okay, thanks.
All right, any other questions? All right, thank you, Representative.
Thank you,
Appreciate your
Senator.
time. Anyone here to testify in favor of this bill? If you're here to testify on this bill, can you raise your hand? Okay, we're going to limit the time. We've got a lot of bills to go through in an exec session, so we're going to limit time to each bill to 20 minutes. We're going to limit testimony in reference to each bill to 2 minutes. And if we see that we're getting close to that 20-minute mark, we're going to ratchet it back to 1 minute per testimony, just so we have people that have the opportunity to testify. So first in favor, come on up, and then keep your time to 2 minutes.
Good morning, Madam Chair, members of the committee. For the record, James Harris, registered lobbyist representing FGA Action, testify in support of this. We think it's good common sense to update the Constitution, especially in light of H.R. 1. You know, in the past when people have talked about work requirements, I think if you went back 10 years ago, this might be a valid point that the technology was not in the place to where it would be easy to comply and do stuff. Because some states had work requirements, others have not. Since H.R. 1 has passed, you now have multiple technology companies. I have 2 clients alone that are banging on DSS and Missouri HealthNet with solutions. And so the technology has really changed to where they're pulling data potentially from credit agencies and other stuff to be able to have this information and make it very easy to comply. And another reason, I don't know if the representative had mentioned, why this is important. If states don't get their fraud rates down, whether it's Medicaid or in SNAP, they'll be penalized. And so, In SNAP, we were at 9.4. I know this is not about SNAP. We have to get down to 6. Medicaid, there's set standards. So this is just a good way to get the potential fraud or maybe errors and people who shouldn't be in the program out to ensure that the resources are there for those who truly need it. Happy to answer any questions.
Great. Any questions for the witness? Seeing none, appreciate your testimony. Make sure you leave a witness form on the table. Next, in favor? Anyone else here to testify in favor? All right, gone. Testify in opposition?
Emily Kalmer, American Cancer Society Cancer Action Network. Thanks for allowing us to share our concerns with this legislation. Moving this resolution forward may unnecessarily tie Missouri's hands as they work to implement the federal work requirements. And just to be clear, work requirements will be in effect, we agree with Representative Chappell, January 1, 2027. However, this legislation is eliminating some of the options provided for in federal law that those who need care, including cancer patients, survivors, and Missourians who may be diagnosed will need potentially. We're still waiting on guidance from the federal government as how they may interpret some of the mandatory exemptions in the federal law. To your point, Senator, so there's an exemption for medically frail individuals that we hope will cover most cancer patients, for instance. But there's a lot of things on the spectrum of a cancer diagnosis. For instance, after you are technically a survivor, but you are still going through a lot of the debilitating effects of your cancer treatment, there are still potentials that you would have issues with meeting the work requirement. The federal law provides short-term hardship exemptions. Those are optional exemptions for things like if you've recently been hospitalized, if you have to travel outside of your area for medical care. The representative's HJR specifically says that the optional exemptions are not an option for the Missouri Department of Social Services under this resolution. So that's one of our concerns. Another concern to the senator's point about the documentation, there is language in the joint resolution that says no applicable individual shall remain enrolled in any month unless the individual has demonstrated compliance with the work requirement. We're not sure how that would be interpreted with regards to the exemptions as well. And obviously, while someone is going through a cancer treatment, or even in the stage where they're going through a diagnosis, there's a lot of impact on their life. So we just want the state to have the flexibility that the federal law will allow and not move forward with this restrictive language. So we're asking Missouri to implement this law in a way that tries to minimize the loss of health care coverage for low-income cancer patients and survivors. And I'm happy to meet with any of you to share additional concerns, but just wanted to put those before the committee.
Thank you. I think you're referencing lines 31 to 35, just for the benefit of the committee.
Yes, and also the optional short-term hardship exemption language is in lines 43 through 46, where it says that the department shall not seek or implement any additional optional exemptions. Those are the short-term hardship exemptions I mentioned. There's some other ones out there, for instance, if your county had a disaster, a federal disaster declaration, things like that I didn't reference, but there's several optional exemptions that this would prevent the department from implementing.
Okay, and just one more question. Would not a doctor's note, as the representative alluded to, take care of some of these concerns? I mean, the doctor would be the one to say, am I wrong? That basically they need the exemption or not.
Well, we don't know under the federal law. The department, the Centers for Medicaid and Medicare Services is still required to give guidance to the states about how you can show that documentation. And we don't have that yet. They're required to do it by June. So we don't know what kind of documentation they will allow. As I mentioned, for instance, like if you're going through a diagnosis, a lot of times the paperwork takes a while to catch up with you. It's a very quick process. We don't want anyone to lose coverage in the times they need it the most because they can't meet with some documentation requirement, but we still don't know what that requirement will be from the federal government.
So is your concern the federal government asking about the documentation? Because there's really nothing we can do in regards to that.
Well, no, my concern is putting something before the voters that would lock it into the Missouri Constitution right now when we don't know yet what what's coming down and what the department may need the options to do.
I guess my question is, there's nothing in here that says a doctor's note wouldn't do that. And so if the federal guidelines do say whatever the documentation of the federal government is, nothing in here limits that documentation.
I think some of the language talks about verification of the exemptions, but it doesn't say how that would be verified. And like I said, I think that's still being developed right now in the process. This is a very complicated process that there's been a pretty short time period for them to get going, and how that documentation uploads into the new computer systems they're building, whether it comes from the doctor, the healthcare system. I think that's all being determined right now.
Which I guess is my point. If that's being determined, nothing in here supersedes that.
It could potentially, because the department may make decisions now while they're working to implement this, and the federal government may make decisions now, and the Senate and the House could approve this, put it before the voters next November, and that could impact things that have already been built into the system.
I guess I'm still not clear how, but thank you for your testimony.
Okay.
Any questions for this witness?
Good morning. I'm just wondering, like, if there's language, well, I don't support work requirements, but I know that it's coming from the feds, but I'm just wondering if there's language that could be put in here to, like, codify federal law, like, when it comes down, because it's not, our timelines aren't aligning, so I don't know.
Well, you know, I know the senator had a version that didn't make the specifications with regard to work requirements. Like I said, this is an area that's very much in flux and is constantly evolving. We're getting new information as to what the states will be allowed to do and what the federal government will require regularly. So it's a little hard to pin down as far as specific language. Our point is this is taking away some of the options that the federal law specifically provides for, and we want all options on the table at this point.
All right, thanks.
Thanks.
Any other questions for the witness? Seeing none, appreciate your testimony. Next in opposition.
Madam Chair, members of the committee, my name is Jay Hardenbrook. I'm the Advocacy Director for AARP here in the state of Missouri. We're a social change organization with a membership of over 750,000 in the state of Missouri alone. We've had lots of conversations about work requirements over the last few years, and I know that you all know that our main concern is making sure that caregivers of vulnerable adults are exempt from the work requirements. One thing that we know for sure is if this resolution passes with the current language is that they would not be exempt under Missouri law. We've been working with the department to try to make sure that we can gather up all of the different data sources that there are for how somebody is a caregiver. We, along, like the representative, would like to avoid self-attestation as much as possible. Perhaps we may have some like affidavit processes. I want to make sure that doesn't count as self-attestation under this. But I think that Ms. Calmer made a lot of the points that I would like to make. We've been working very hard with the department to try to get this all figured out before the June release of these regulations, right? So the regulations are coming out after session is over. We're very concerned that this restrictive language inside of this bill could prevent us from being able to do full implementation the way we want to. Plus, the representative talked about the error rate. The errors are set by what we decide that we have to do. So every new restriction we put on ourselves as a state potentially raises our error rate. So by putting in extra restrictions, we could actually be endangering our Medicaid funding going forward. So I want you all to watch very carefully what the department does here. I want there to be very much oversight. Let's start next year after they've actually done implementation. There is no reason why you have to do this right now. They are implementing work requirements. That is going to happen, as has been laid out by the representative. Next year, if they have messed this up, I want you guys to come back. I will ask you guys to come back and look at what they've done to make sure that it's right. But this is getting the cart way ahead of the horse. Thank you so
For your
much.
testimony. Any questions for the witness? Seeing none,
Thank
appreciate
you.
your time. Next in opposition.
All right, good morning. Thank you for your time. My name is Elma Rogers. I'm a resident in District 19, And I'm here in opposition for HJR154, sorry. The work requirements mandated in HR 1 already create new administrative burden for state Medicaid programs. It's requiring more staff, system upgrades, as you heard, computer systems, additional processes, education, and outreach to beneficiaries. So HJR 154 would put additional strain on the already strained system by requiring checkpoints that go beyond the requirements that are currently in HR 1, such as Medicaid requirements would have to report every month, Medicaid recipients would have to meet work requirements for 3 months before eligible for health care. There are no exemptions for natural disasters, no exemptions for hardship, such as, remember the tornado in St. Louis, and people have lost all their records, and there are groups now really trying to work to find all the records for them so that they can apply for benefits and, have things fixed. All of this will require additional administrative burdens for state Medicaid programs. And computer systems, if you start, as he said, there are companies now vying to help upgrade the computer systems for the state. When HJR 1 goes into effect, the feds are also going to have systems. If you have conflicting computer systems, that's where a lot of errors occur, because what you build into it now without knowing what's going to be there for the feds, that's actually just going to cause errors in the system. I think we're seeing a lot of that currently with the budget business that's gone on. About
20
9 and
seconds
10
left. I just want to let you know. Go ahead.
Okay. About 9 in 10 Missouri adults with Medicaid are currently working, caregiving, going to school, or have a disability. So the federal revenue savings that are projected from work requirements, as far as I can read for everything I've looked at, are not because people find jobs or get health care elsewhere. They lose their coverage because it's administrative burdens and extra red tape that conflict in the reporting.
Thank you.
So I oppose this, and I hope you do too.
Thank you. Make sure you fill out a witness form and leave it on the desk, please.
Yeah,
Thank
that's
you.
right.
Any questions for the witness? Seeing none, thank you for your time. Next in opposition.
Good morning. My name is Ryan Reza. I'm with Susan G. Komen. I cover Kansas, Nebraska, and Missouri. I want to echo some of the comments made by witnesses prior. We've seen states wanting to implement Medicaid work requirements before that June the June set of guidelines that CMS is going to recommend this summer, and we just urge caution. In Nebraska, they're implementing a specific set of regulations that saw a lot of public pushback because of just the uncertainties and what's going on and what CMS is actually going to recommend in June. Similar to what some of my colleagues have said prior, we believe if this was covered next legislative session, we actually think we could have a lot more of a productive dialogue. Another aspect of the current resolution that we're worried about is actually that this may impose additional costs on the Medicaid program here in Missouri, specifically page 3, line 47 on managed care organizations, as we adjust how eligibility determinations are kind of determined and what organizations are actually allowed to do that by prohibiting managed care organizations. We actually fear that there may actually be a lot of kind of continuity errors in folks who are currently on Medicaid or receive Medicaid benefits. Komen is one of the leading advocacy organizations on breast cancer across the world. What we care about is making sure our patients that we advocate for receive continuous coverage. And so by making these adjustments without CMS guidance, and then also making the adjustments where DSS has to undergo a significant change in their systems, and then also changing how managed care organizations operate in the system, we just fear some of the folks are going to fall through the cracks, and that we're going to actually implement restrictions here in Missouri that we're not going to be able to go back and change. And so what we just urge is caution, maybe hesitate a bit this session and then go back at it next session, because we do agree that HR 1 has passed, Medicaid work requirements are coming. We understand the importance of making sure federal law is followed. Thank you.
Thank you for your testimony. Any questions for the witness? Seeing none, thank you. Next in opposition.
Thank you for allowing me to testify. I'm Suzanne Opperman. I'm a psychiatric mental health nurse practitioner. First, I want to repeat that everything that they've said so far, I second, so I'm not going to repeat that. The one thing that concerns me is that the basis of this bill is based on the one big beautiful bill that came from the national level. There are no evidence to show that people are scamming the system. It's not been proven anywhere. The assumption is that everybody on Medicaid is just trying to get something for nothing. I work with clients who are mentally disabled. There is no way that they can actually even work 80 hours a month. They don't have the mental capacity. They have neurodivergency. They may be socially active. They have social anxiety. Just all kinds of reasons that could happen for that. Missouri's number 43 out of the 50 states in healthcare outcomes in general. We're at the bottom of the barrel. This is disgraceful. One of the things I want to be sure the committee knows is that you realize that for rural money from the national level, we are only getting 50% of what we could get because advanced practice nurses don't have full practice authority. And the governor mentioned this in his New Year statement, that, oh yeah, we're going to help with rural health. Well, so we only get 50% because we're the most restricted in the country for advanced practice nurses. And so we are not able to be out in the rural areas. We can't get providers to collaborate with us for anywhere from $12,000 to $52,000 a year that we are expected to pay them. So I just want to say that we have so much more resources available. There's 17,000 nurse practitioners in this state. Many of them leave because they don't want to deal with all of this restriction stuff. So they go to all the states around us.
Okay, thank you.
Questions?
Nope. Looks like we're good.
Thank you.
Thank you. Make sure you fill out a witness form and leave it on the desk.
Right there.
Anyone else? We're going to limit testimony to 1 minute now.
Oh, goodness.
You're the lucky winner.
All right,
So-
I'm the
sorry about
lucky
that.
winner. All right, thank you guys, senators, for your time today. I'm Jamie Blair with Missouri Rural Crisis Center. We're a member-based grassroots advocacy organization who's been working for the last 40 years to promote family farms and lift the voices of rural communities. The proposed changes to our state constitution and HJR154 would have staggering impacts on Missouri, and we fear our rural communities would feel those impacts the most. A lot of the stuff in my testimony has already been covered by others, so I will just skip down to more than 18% of rural residents currently rely on Medicaid to access health care, and we know that 90% of those recipients are working or exempt, yet 170,000 Missourians may lose coverage if this bill is made law. That means that Medicaid dollars are helping to keep our rural hospitals open. Of the 29 hospitals at risk of closure in Missouri, 12 are in immediate risk, and the reality of those closures would mean preventable deaths. Rural residents' drive times to the nearest hospital are already often greater than an hour, and if more of our hospitals close due to lack of funding caused by these requirements, everybody in our communities will suffer, not just those on Medicaid. And I will leave my full testimony with my witness form in hopes that it will be entered into the record.
Perfect.
Thank
I
you.
don't know what you do as a side hustle, but if you wanted to be one of those commercial people that
Right?
speak really
Well, you
fast
told me
for
I
the
had
end.
1 minute, so I was
mean,
trying to get it
you
out.
might have a gig there. Anyway, thank you very much for your
Thank you.
testimony. Any questions for this witness? See, we got one?
Yep.
Senator Lewis?
Yes.
Hi, that was fast, but good. But you spent some time in my office a couple weeks ago, and I'm live in urban but care about healthcare throughout the state. So can you link a little bit more to how this ties to closures of rural hospitals?
So like I said, 18% of rural residents rely on Medicaid directly for their care. So that means that's a goodly portion of what our hospitals are looking at for revenue. When you add in Medicaid to that, it comes up to 72%, or Medicare to that, I'm sorry, it adds up to 72%. And we're talking about hospitals that are, some of which are operating on 48-hour budgets right now. They can't afford the loss of revenue that these preventable loss of services would cause.
And what percentage of hospitals or how many hospitals are at risk?
Currently, it is 29 hospitals that are at risk. 12 of those are at risk of immediate closure.
Okay, thank you.
Thank you. Any
All
other
right.
questions?
Thank you. Appreciate your time. Next, in opposition.
Chair, members of the committee, Mara Patel on behalf of the American Heart Association, just wanted to go on record in opposition to HJR 154. I'll put my testimony
Thank you.
for the record.
All right, appreciate it. Thank you. Any questions for the witness? Seeing none, appreciate it. Next.
Thank you, Chair. Brian Colby with the Missouri Budget Project. We are very worried about these error rate audits. There's a change in HR 1 that has real penalties for these error rate audits, and the errors occur when we enroll and determine eligibility. We're afraid that putting restrictions on that process at this time could increase error rates and increase the penalties, and these penalties are in the hundreds of millions of dollars, really significant. Would be happy to talk offline about it if you're interested. Thank you, Chair.
Thank you. Any questions for the witness? Seeing none, appreciate your time. Make sure you leave a witness form on the table. Next.
There we go. Madam Chairman, members of the committee, I am Kelvin Simmons, registered lobbyist for the Health Forward Foundation of Kansas City. We are here in opposition of HR 154. I will just like to echo most of what has been said by the previous witnesses. Won't take up too much of your time. No, I have 1 minute and can't talk as fast as the other lady before me. So we would just say that we are very concerned about the timing of the implementation of this, and we think that the department should have greater opportunities for flexibility for some of the exemptions. And that's one of our biggest concerns. If there are any questions, I'd love to try to answer any questions that you might have.
Thank you. Appreciate your testimony. Any questions for the witness? Seeing none, thank you again for your time. Next in opposition, 1 minute 25.
Good morning, Katie Gamble here on behalf of the Missouri Association of County Developmental Disability Services. I want to thank the representative for all the work he's done on SCS. And our concerns were highlighted a little bit earlier, but just some questions around caretakers of individuals with developmental disabilities. And then also, we're working through some things with what's coming down from the feds in regards to ex parte verification and people with disabilities maybe not being in the right category of Medicaid under the ABD population versus being in another portion, and they wouldn't be eligible for that verification. And so anyway, we're working through all of that, and so we'd just like to continue to do that without having our hands tied.
Thank you. Any questions for the witness? Seeing none, appreciate your time and testimony. Next in opposition, and this, we'll have one more in opposition, then we're going to go to informational purposes.
Okay, thank you. Chair, members of the committee, Jessica Petrie here for the Reach Healthcare Foundation. Just want to reiterate the concerns about this language tying the department's hands. It's really important that, work requirements are clearly coming down, but we want to get them right. And these restrictions aren't just going in statute where you all have the authority to change them if we need to. This is a constitutional amendment which would be exceptionally difficult to change in the future. And if we're going to do work requirements, we want to do them right. And we're worried about tying your hands and the department's hands and implementing it effectively. If you have people coming on and off the rolls for Medicaid, it's only going to increase costs. People are going to be sicker, not stable on medication, more ER visits. This is something I know nobody wants. So we very much respect the representative's intent and desire to do the right thing for Missouri Medicaid. We just believe that requires flexibility for you all in the department to implement this effectively, and don't think this is the right approach. Happy to take any questions.
Appreciate your time. Any questions for the witness? Seeing none,
Thank you.
All right, one more. Any more testimonies in opposition? Oh, you guys are good. Oh, all right. You're good. Information. Okay, come on. No, you are still good. Informational purposes.
Good morning, Madam Chair, members of the committee. My name is Jane Drummond, and I'm here on behalf of the Missouri Hospital Association. I want to start by saying I think I agree with everything Representative Chappell said when he introduced the bill. I do want to raise a point of statutory construction. Anytime the legislature changes a statute or a constitutional provision, there's a canon of construction that says every change has to have meaning. So when you look at this proposal, it changes a number of provisions of the Constitution, including removing 2 entire subsections that do more than just talk about work requirements. So when you compare it to Senator Carter's own SJR 103, it achieves the same thing much more simply. It simply says, notwithstanding everything else, the state has the authority to impose work requirements. So I am concerned that the more we touch in the Constitution, the more it opens it up to issues of construction, interpretation, ambiguity, that there is a simpler and more straightforward way to do this, and that would be under the terms of SJR 103.
So would you be happy with the language of that SJR?
Yes, we would support SJR 103.
Okay, thank you. Appreciate your testimony. Any questions for the witness? Seeing none, thank you. All right. Representative, any closing comments? It sounds like you have talked, you alluded to the fact that you're willing to address some of the vulnerable youth and adults exemptions, natural disasters, whatnot. Where's the department stand on this, just in closing?
Well, the department and I have had discussions about everything. I am totally open to having those individuals who care for those who are suffering disabilities and medical conditions. I'm totally open to that. I would draw the attention, though, of the committee to lines 45 and 46, wherein it says that, yes, the Department of Social Services is not permitted to seek any optional exemptions unless a general statute law expressly authorizes the implementation of the exemption. So we still have the capacity to say we would like to move forward. I also would like to address the idea that we don't know what the national government is going to do. I agree, and I never am going to be guilty of underestimating the ridiculous nature of Washington, D.C. However, regardless of what we do or don't do, that's going to supersede whatever's in our Constitution. So even if this is in place and then they decide these are the rules, these are the regulations, we'll have to conform with those irrespective of what we do here today. But we will not always have an administration who views these things this way. And I believe it is a good policy. I believe it is one that is necessary. I'm thrilled to hear so many individuals say that 9 out of 10 Medicaid expansion recipients are already working. I think that's fantastic. I'm not sure I understand why everybody's worried about them then, if they are already working. We can certainly have the documentation provided. And for that 10th individual, the one that's capable and unwilling to work, those people should not be on the public dole, not at the expense of these children that need SDS programming and so many other individuals across the state who are among the most vulnerable of our citizenry. I believe we have a responsibility to provide for those who cannot provide for themselves, and one way in which we can make certain that we have the capacity to do that is to not allow individuals who could and chose not to continue to drain the funds that are finite. I know the Vice Chair of Appropriations is on your committee, and he and I both know all too well just how finite the funding is in the state of Missouri.
Which is a bigger risk to these benefits, in my opinion.
Yes, ma'am.
Thank you, Representative Chappell. I'd love to help you see if we can get this across the finish line. Let us know how we can help. Appreciate your time here today. Thank you. All right, that concludes the hearing for HJR154. We're going to now convene the committee. And Mr. Secretary, please call the roll.
Senator Carter.
Here.
Senator Nicola. Here. Senator Lewis. Here. Senator Hudson. Here. Senator Nuremberg. Quorum is established.
All right, with quorum being established, we are now going to go to Senator Gregory, Senate Bill 1137. Did he speak? All right, Senator May, let's start with you. Senate Bill 1024.
Good morning.
Begin when you're ready. Just committee, I just want to, there's been some discussion, just a housekeeping thing I want to bring up. There's been some discussion about the importance of letting the people testify who come so far to testify, and I want to make sure that we're giving as much time to them as possible. So therefore, with as many bills as we have, we're trying to limit each bill to 20 minutes. So when you have a question, just be mindful of that it needs to be pertinent to the topic, and we want to make sure that everybody who's here to testify has that opportunity. And our questions sometimes take time as well, so thank you as we move forward. Go ahead, Senator May.
Good morning, Madam Chair and members of the committee. For the record, I am Senator Carla May. I'm representing the 4th Senatorial District. I present you today Senate Bill 1024 for your consideration. Senate Bill 1024 updates Missouri law regarding opioid prescribing practices to promote safer pain management, reduce the risk of misuse, and protect the patients and families across our state. The bill strengthens standards around opioid prescriptions while encouraging the use of appropriate evidence-based alternatives when possible. Senate Bill 1024 simultaneously ensures appropriate care is provided to patients with legitimate pain needs while reducing the risk of addiction, misuse, and overdose. Missouri, like much of the nation, continues to face the ongoing impact of the opioid crisis. Families, children, and communities are still dealing with the consequences of addiction and overdose. This bill recognizes that prevention often begins at the point of care. By improving prescribing practices, Senate Bill 1024 aims to reduce unnecessary exposure to opioids, support providers in making safer clinical decisions, and promote early intervention before misuse begins. This bill acknowledges the important reality that patients experiencing acute or chronic pain must not be left behind. Senate Bill 1024 encourages thoughtful prescribing, patient-specific care, and the use of non-opioid treatments when appropriate and available. This includes recognizing the role of alternatives such as physical therapy, non-opioid medications, and other pain management strategies. Senate Bill 2024 also supports a more consistent approach across providers, helping ensure that patients receive clear expectations, providers have clearer guidance, and the system works more effectively as a whole. This is especially important in rural and underserved areas where access to both providers and alternative treatments can be limited. Let me be clear, this bill is not denying care. Senate Bill 1024 is about preventing addiction before it starts, while ensuring Missourians can still access the care they need to manage pain safely and responsibly. This bill focuses on prescribing practices and patient safety. It does not prevent legitimate medical use of opioids when clinically appropriate. Families are often the ones who experience the consequences of addiction firsthand. Strengthening how we approach pain management is a step toward protecting not just individual patients, but entire household. This is both a public health bill and a family stability bill. Thank you, Madam Chair, and the members of the committee for allowing me to present this bill today. I'll
Thank
take any
you.
questions.
Appreciate it. Any questions for the senator? Go ahead, Senator Nicola.
Thank you, Senator May. I appreciate it. You're one of the reasons why I support expanding term limits, just to let you know. Thank you for this bill. I have a very similar one, too, and I think it's a decent piece of legislation, so thank you for bringing this.
Thank you.
Any other questions for the witness? The senator, thank you. Appreciate your time. Anyone here to testify in favor or opposition on this bill? Raise your hand. Okay, great. Nobody's here to testify. Just want to make sure. All right. Thank you, Senator. Thank you. Senator Mosley. Senate Bill 1499.
Bless you.
Excuse me.
Oh, bless you. Gosh. I'm going to clean that up.
There's a reason why I turned to the left. My hands were covered. Thank you, Senator Mosley. Begin when you're ready. I apologize for that interruption.
Greetings. I am Senator Angela Mosley, representing the 13th Senatorial District. Thank you to the chair and the committee for hearing this bill today. Did give a substitute, and all that was doing was modifying the examples of covered nutrition services. This is a food as medicine bill. Senator Henderson has one as well, so hopefully we will be merging our bills together.
Is it Henderson or Hudson?
Jesus. Hudson. H&H. Hudson. He knows I'm looking right at him.
That's why I asked. Thank you.
I told him I have to come by his office so we can get to know each other better. This act creates the Food is Medicine Act. Under this act, the Department of Social Services shall submit a waiver to the Centers for Medicare and Medicaid Services for Food is Medicine program. The program shall be designed to improve health outcomes for MO HealthNet participants with nutrition-related chronic diseases through nutrition services and reduce the need for medical care for those participants. Since we're in a hurry today, I won't go through all this. But it's to help with chronic diseases. Instead of people having to go to ER, they will be given a plan to help them with nutritional diets to prevent these chronic diseases or to cure the chronic diseases such as diabetes, heart disease, hypertension, kidney disease, and obesity. And I did have the pleasure of going to a hospital within my district, Christian Hospital, and they do have a garden that they have that is for just this, food is medicine. And I think someone is here from them to be a witness.
All right, thank you. Any questions for the senator? Let's see, Senator, is it Hudson?
Hudson, yes.
Hello.
I'll answer to about anything, and I've been called much worse than what she called me earlier. Senator, I just want to make a comment here, if it's all right. I appreciate your work on this very important issue, and I would be absolutely happy to work with you on it if it pleases the committee, and our colleagues would love to maybe discuss some kind of bill string or something where we can team up, partner on this, and hopefully get this across the finish line. So thank you for your work.
Thank you.
All right, any other questions? Seeing none, appreciate your time, Senator. Anyone here to testify in favor of the bill? All right, comment on first contestant. I just slip button. Yep, we're still doing 2 minutes. Begin when you're ready.
Thank you, Madam Chairman, members of the committee. I am Kelvin Simmons here representing Health Forward Foundation as its registered lobbyist. I want to thank the Senator for her work. Understand that there are other bills that are similar. Would happily support those bills too. We thank the Senator because we think a food as medicine program in Missouri HealthNet represents an evidence-based strategy to improve health outcomes, reduce health care costs, and strengthen Missouri's economy. Research shows that, a food as medicine intervention can help hospitalizations, reduce hospitalizations, and overall health utilization, generating cost savings to the state's Medicaid program over time. Again, we appreciate the work of the Senator and her leadership on this issue, and if you have any questions, I'd be glad to answer any that you might have.
Thank you. Any questions for the witness? Seeing none, appreciate your time.
I'll leave this. Thank you.
Thank you.
Thank you,
Next
Senator.
in favor? Begin when you're ready.
I'm gonna sit right there,
It's a little crowded there. Sorry about that.
Oh, no worries, no worries. So good morning, Chairman, Vice Chair, and members of the committee. I just looked this direction for Vice Chair. Is that okay? So thank you for the opportunity to testify today. My name is Nicole Chung, and I am the Executive Director for the Christian Hospital Foundation. For more than 120 years, Christian has been serving families in our region. Every day, we care for patients managing chronic diseases such as diabetes and congestive heart failure. What we see consistently is this: medical treatment alone is not enough. If we do not address the conditions people return home to, we will continue to pay for preventable crisis. In North St. Louis County, the zip codes surrounding our hospital face high rates of chronic disease, food insecurity, and limited access to full-service grocery stores. In just one recent month, more than 700 patients in the 63136 area screen positive for food insecurity. Many of these individuals are trying to follow physicians' guidelines to manage their chronic diseases or heart disease, but they lack reliable health access or healthy access to food. These challenges are not unique to North County. Similar patterns exist in rural Missouri communities where hospitals often face the only access points for care. Grocery options are limited and chronic disease rates are high. Whether in a rural town or an urban neighborhood, when access is basic, necessities is limited.
Thank you for your testimony. Any questions for this witness? I can clearly see that you're passionate about this issue. Appreciate you coming up and testifying in favor.
Thank you.
Thank you. All right, next in favor. More work to get in and out of the chair than it is to testify, isn't it?
Morning, Madam Chair, Committee. Thank you, Senator Mosley, for inviting us to testify. My name is Brian Hokamp. I'm the Director of Operations and Support Services at Christian Hospital. Nicole talked a little bit about Christian Hospital as a background, but I want to tell you about the great work we've been doing for the past 7 months. Christian Hospital provides a food as medicine program currently. We have a multi-tiered approach to do this. We identify patients that are food insecure through our social determinants of health assessment in the hospital. Once they're identified, we have a couple different ways that we can provide this resources to them. One, we have a food pharmacy to where we can provide shelf-stable foods and medically tailored meals to the patients if their immediate need is necessary. We then meet them in their homes and do further assessments to identify what other resources they need. We've established a garden, as the Senator mentioned, where we've produced over 125 pounds in the past 7 months of produce that we've then given out to our community members. We've seen significant decreases in revisits and readmissions for our population and community that we've identified, down to about 5% revisit readmission rate, which is a significant impact when it comes to cost. And we know that we can provide great, excellent care, provide medications, but if they don't have the food and the nutrition and the education to do that, then they're not going to be able to stay outside of the hospital. We also understand that there's an opportunity to reach our children. So we're starting to work with school districts to get them involved in producing the produce, but then also teaching them how to cook it. We started teaching kitchens, so we have a monthly teaching kitchen where they come in and they learn how to prepare these healthy options versus just going to a corner store because we are in a food desert. I'm happy to answer any questions.
Thank you. Any questions for the witness? Seeing none, I appreciate your time. Thank you for the information. All right, next in favor. Go ahead.
Good morning, Chair, members of the committee. Mara Patel on behalf of the American Heart Association testifying in support of Senate Bill 1499. I wanted to thank Senator Hudson and Senator Mosley for championing this issue in the Senate. An estimated 90% of the $4.3 trillion annual cost of healthcare in the United States is spent on medical care for chronic diseases, and for many of these diseases, diet is a major risk factor. So because of this, our organization has created an initiative called the Healthcare by Food Initiative, and under that, we've been walking alongside states and implementing food as medicine programs. And even though the trials are limited in scope, they are showing great promise. So for example, North Carolina and Massachusetts were two of the first states to implement through the 1115 waiver process, and both of them have shown a reduction in healthcare cost and emergency room visits. So again, great promise with these pilot programs. I did want to note we did make some language change recommendations that I believe will be included in the substitute and are already included in the House version. And last but not least, the American Heart Association has an MOU with the U.S. Department of Health and Human Services to provide free TA services. So if Missouri were to move forward with a waiver and it were to be approved, then we could walk alongside the Department of Social Services in implementation and evaluation, so they would not have to do that on their own. And with that, I'm happy to answer any questions.
Great, I appreciate the information. Any questions for the witness? Seeing none, thank you for your testimony. Next in favor. We're going to go to 1 minute for testimony now.
Good morning, Madam Chair, members of the committee. My name is Mallory Rush. I'm the Executive Director at Empower Missouri, here to testify in support of this bill. I want to thank both of the sponsors for bringing this legislation. I think the most important thing to recognize is that food as medicine is really just a long-term investment in family stability, workforce participation, and community resilience. So chronic conditions that have been discussed today, like diabetes, heart disease, and obesity, don't just impact individual health. They create an ongoing financial, emotional, and logistical strain on families. These conditions often require lifelong management, increase the risk of complications, limit overall life satisfaction, and can limit a person's ability to work or care for others. And over time, this instability can spiral out, impacting families and communities. Food as medicine is prevention, and prevention always costs less than treatment. The witness before me talked about some of the studies that have happened. There are very promising results. Different studies across the country have shown results such as decreasing emergency department visits by 70%, hospital admissions by 52%, and overall healthcare costs by 16%. So I appreciate this committee's consideration, and thank you for your support.
All right, thank you. Any questions for the witness? Seeing none. Testimony, next in favor.
Yeah, we need more distance between
Me too.
becoming a
They
real
need to move
issue for
forward.
me.
They're always so crowded.
Chair, members of the committee, Jessica Petrie here for Feeding Missouri. It's the coalition of 6 food banks that serve every Missouri county in the city of St. Louis. Our food banks work really hard to increase the percentage of healthy foods that we're serving in our communities, because we know that that ties into chronic disease and overall health. So being able to set up a statewide infrastructure to expand access to some of those programs would be beneficial for families, but also we believe beneficial for the Medicaid program as a whole, as you start preventing some of those chronic conditions and help people manage those more effectively. So our food banks are working with pantries and faith-based organizations all over the state on food boxes and other models to get more healthy foods into the hands of families. And this is a really important step to broadening those efforts. So very much appreciate the sponsors' work.
Thank you. Thank you for your testimony. Any questions for the witness? Seeing none.
Thank you.
Thank you again. All right, next in favor. Perfect. Anyone here to testify in opposition? Anyone here for opposition? Informational purposes? Thank you. Come on up.
Thank you. Morning, Chair, members of the committee, and I'll be brief. I'm not as fast as her, but I'll try. Okay. My name is Dr. Jennifer Bean, and I'm the Health and Mental Health Legislative Policy Fellow for MOST Policy Initiative. As you may know, MOST provides nonpartisan evidence-based research services for the Missouri General Assembly at the request of legislators. Today, I'm here to testify for informational purposes about SB 1499, but specifically about food prescriptions. Food prescriptions are medical orders for specific foods to help patients manage diet-related medical conditions, such as cardiovascular disease, diabetes, and obesity. They are a component of the food as medicine approach, which provides healthy foods alongside medical nutrition therapy. Food prescriptions include produce prescriptions, medically tailored groceries, and medically tailored meals, which align food items with the patient's specific diagnosis. As heard from the gentleman from Christian Hospital, to be eligible for a food prescription, a person needs a diagnosis of a diet-related condition, but also have documented food insecurity or limited financial ability. Other licensed, so dietitian, registered dietitian nutritionists, also called dietitians, are specifically trained to provide this sort of therapy and screening. To reiterate, food prescriptions are funded through federal grants and programs, private insurance, and through state Medicaid programs like the 1115 waiver. Thank you for the opportunity to provide this information. I'll leave my whole testimony, and I have copies of our science note if the committee would like it.
Thank you. You did that pretty well, pretty quickly. Thank you.
so much
Any
more
questions
to
for the witness? Seeing none, thank you again for your testimony. All right, Senator Mosley, any closing comments?
Thank you again for this opportunity, and hopefully we can get this voted on out.
All right, thank you. All right, that concludes the hearing for Senate Bill 1499. We'll now go to House Committee Substitute House Bill 1948. Representative Gragg. ready, Representative.
Good morning. Representative Jamie Gragg, House District 140th. I am bringing House Bill 1948. It is, you've always heard the simple bill, right? Well, not a simple bill, but it's a problem that we've heard around and around and around. The issues that we hear every day around this building get old. They really do. We hear about the problems in our incarceration rates. We hear the problems in our schools. We hear the problems in our homes. I'm going to go over a couple of statistics. 71% of our high school dropouts come from fatherless homes. 71% of our teenage pregnancies come from fatherless homes. 90% of our homeless and runaway children come from fatherless homes. 85% of our children who exhibit behavioral disorders come from fatherless homes. 75% of our adolescent substance abusers come from fatherless homes. 70% of our juveniles in state-operated institutions come from from fatherless homes. The statistics go on and on and on. We have a lot of issues that plague our society, and they come from fatherless homes. We have a fatherless epidemic. So we need to address this somehow. And I don't believe government telling people how to father is the issue. But we need to get our community engaged. Our community organizations, our nonprofits, and hopefully our churches will step up as well. So this is the fatherhood engagement bill. We presented it last year, and it went all the way over here to the Senate. And unfortunately, time ran out, and it was very successful. And so we presented it again this year, and so far it's gone very well. We've only had, in the whole trek so far, only four in opposition. And so how it works and how the bill is presenting is through the Department of DSS, there is a line item created in their budget, and right now I'm not asking for any appropriations. I don't think this is the year to be asking for anything, and I don't think next year either. So it is left open and available for grants, donations, anything, any way that anybody wants to place any appropriations or money in there is fine. And down the road we can address that. But any monies that can be put in there down the road can be applied for. And there is a person in the department that will oversee that. In your fiscal note, you'll notice that there is one FTE on there. That person is actually already in the department. So it shows that there's one person that will be hired, but they're actually already in place. That person will review the applicants, and those dollars will go towards hiring, training, and facilitating fathership engagement professionals out to any community organization in the communities around the state of Missouri, and they have to use those dollars, like I said, to hire, train, and facilitate community engagement professionals. And they're kind of like a caseworker or a one-on-one engagement person with fathers who desire to be engaged with their children, who have roadblocks or stops that keep them from being engaged with their children. This doesn't. This program is not for the fathers who want to leave and don't want to be engaged with their children. Unfortunately, we have too many of those in our society, and you can't lead a horse to water, unfortunately. But these are the fathers who desire and want to be with their children. These are the fathers who want to keep these statistics from happening. So when you have fathers who have roadblocks, well, they sometimes need a little help to find out how to navigate those and to be those fathers. So this professional, this fathership engagement professional, will help them navigate those, whether it's the court system. Maybe there's some issues that they need to help navigate, or maybe some issues they need to navigate within themselves. Maybe they have to find avenues on how to seek better employment so they can afford a lifestyle which children within the home can have a better life. Maybe they need to navigate how to have better relationship with mom. Sometimes the relationship with mom is a barrier they need to navigate. We need to make sure that these children have a better life and a better future so that when they are older, that we have a better future for them. So ultimately, this is called the Fatherhood Engagement Bill. It's really a kid bill when you get down to it, because ultimately we need to make sure our kids have the best chance they get. Because, again, I can read further and further on our statistics here, but we're failing our kids by not giving them what God intended them to have, a mom and a dad. So with that, I will take any questions.
Thank you, Representative. I love the concept of this piece of legislation. My son is a single father. I just really appreciate strong men and their willingness to step up and help raise kids. It's more needed, I think, now than ever before. And bringing more value back to that, I think, is something culturally and in society we need to make sure that we're strengthening. So I appreciate this piece of legislation. Any questions for the representative?
Good morning, Representative.
Good morning.
I appreciate your heart and your intent, and I completely agree with you. We have and have had for some time in our culture a fatherlessness major problem. I'm just not sure it's government's role, and you mentioned that too, and I appreciate that comment too. And so I'm just cautious of passing anything that would actually open the door for government to enter into this kind of arena. I think it's best left to the communities, the churches, the nonprofits, and things like that.
Agreed.
It is a major issue. That's for sure. And I don't think it's addressed in the churches. I'm a pastor, been a pastor for decades, as well as it probably could be. And I appreciate your intent and your heart for wanting to address this issue. So thank you.
Sure. Yeah, and that is, I've heard that quite a bit and addressed. You know, a lot of the roadblocks that fathers do have in their way, unfortunately, come from government. So by no means do I think the government has any right whatsoever in telling parents how to parent, fathers how to father, mothers how to mother, and children how to be children. I don't think that's the role of government. I actually 100%, 120% agree. But I believe that we have the ability to make the way for our community organizations to be able to do so, because they're the ones in the community. They're the ones that have those resources. They're the ones that know the community best, because each community is unique. You know, I know from Southwest Missouri, where we are way different than the community where you come from, which is more of a bigger community. You've got people more in a tighter community. So your areas are a little different. So if we can make those organizations amp up a little bit more, then we might be able to reach those fathers a little better.
Appreciate it.
Thank you.
Any other questions for the representative? Seeing none. Thank you, Representative.
Thank you.
Anyone here to testify in favor? Okay, great. Go ahead. 2 minutes.
Thank you, Chair, members of the committee. My name is Mark Ludwig from the St. Louis area. I'm here to testify in favor of the bill. We've got a fatherless epidemic across the country, as the representative has already mentioned. It unfortunately was created by a lot of government programs. The welfare programs in the 60s in St. Louis, we have Pruitt-Igoe, that in order to qualify to live there, there had to be no father in the home. So we pushed fathers out of the home. Every TV show you see right now, I grew up in Leave It to Beaver Day. Nowadays, every TV show, the father is the buffoon, and so we have a society that has pushed fathers out, and we need to pull fathers back in. This bill will help address 3 types of fathers. One is fathers who've been pushed out by the family court system that need help navigating that legal system. One is fathers who thought they never had a chance and they need a pathway back into their child's lives. Another is involved fathers. Unfortunately, they never had a role model. They grew up without a father. And I do agree with the senator. Normally, I'm against any government programs. I don't think it's the government's role. Unfortunately, right now, we have a lot of programs and some very good meaning programs for single mothers, but not a single program for fathers. I like what the representative has designed, which is a combination of reaching out to local organizations that know their community's needs much better than one centralized government type program. But I like the emphasis on this program. The return on investment, you know, we're currently spending millions of dollars by this fatherless epidemic. I mean, one father in prison, if you look at the cost to our state, compared to 1 FTE for someone to help sort of quarterback what can we do to get fathers engaged. Currently been working with the White House and HHS on creating a commission for fathers, men, and boys. I'll be back at the White House again in 2 weeks. And a lot of what we're talking about is patterned after this very bill. So I urge you to strongly consider this bill. It changes from a punitive measure, which is what most father organizations do right now, to one bringing fatherhood engagement and celebrating fathers. Thank you very much.
Thank you. You know, I saw there was and this is just a comment, but that I saw where in Louisiana they were having, you know, a lot of fights in schools and dropout rate was excessive, and they were trying to figure out how to fix this. And what they did was they put dads in the schools to wander the halls. They volunteered. I mean, it was 3 or 4, you know, a month that they rotated through, and the dropout rate went to almost nothing, and the fight stopped. And so, anyway,
yeah, I'm actually involved with the fathers that organize that program. It's a great program they
It's
have.
just amazing. And so just to have those, they were just dads that were there to volunteer, wander the halls, and be friends to these kids, and it changed the whole culture of the school. So anyway, thank you. Thank you for your testimony. Any questions for the witness? Seeing none. Thank you again for your time. Next in favor. Go ahead. No, go ahead. You're here. Go ahead and sit down, and we'll go to you next.
Hello. My name is Curtis, and I am a parent educator who works exclusively with fathers. Most of the clients I work with are coping with an unexpected pregnancy and trying to rise to the occasion. One such guy, Lucas, signed up for my class as a 19-year-old. He had just found out his girlfriend was pregnant with their second child. They had had an on and off again relationship, and he had been excluded from the first 8 months of his daughter's life. At that time, he was also sleeping in a grandparent's basement, working a minimum wage job, and lacked a father figure or a male role model in his life. Day 1 of class, I asked the guys why they've enrolled in this program. Lucas stated that he wanted to be different toward his girlfriend and be there to support her and the baby this time. Throughout the 6 weeks of class, we cover a variety of topics. Obviously, the essentials of caring for babies, swaddling, diapers, all that stuff, but also attachment theory, work-life balance, career planning, healthy communication, and financial management. Our classes are highly interactive and enable guys not only just to learn something new, but actually work it out in their life with a group of other men around them. I had the privilege of tracking with Lucas throughout this course, and for weekly case management calls afterwards, throughout the duration of the pregnancy. I can attest that because of this intentional and focused support, Lucas completed his GED, became an apprentice low-voltage electrician, took the lead on touring hospitals with his girlfriend, and dramatically improved the quality of his relationship with her. He's also well on his way into moving into a townhome. So in a matter of months, this guy made substantial changes in his life and is now positioned to be a capable, present, and involved father to his 2 daughters. He had another girl. Although Lucas is unique to me, I can attest that many other fathers in Missouri are in his same situation, and that passing this bill would enable agencies like mine and other similar agencies to expand our services to fathers. And I can submit this to you guys so you can see the whole story too.
All right, I appreciate your testimony. Any questions for the witness? Okay.
Thank you for your testimony. I'm fairly familiar with your program at Resource Health, since there's one in my district as well. And it's just a good example, too, of how the community and organizations like yours can address this problem. And again, I think that's best left there and out of the government's hands. So thank you for the work you're doing. I appreciate it.
Thank you.
So explain to us how this bill will help your program. You said it will help your program.
Yeah, so we're a nonprofit. We're funded by local individuals, but also through grants, and being able to apply for assistance to expand these programs to enable us to hire more guys like me would enable us to do better, would enable us to expand those services for our community.
So this is like a scholarship or a grant program?
Yes.
Thank you. Any questions from the witness? Seeing none, appreciate your time. Thank you. Make sure you fill out a witness form and leave it on the table. Okay.
Hi, my name is Tim McConville. I'm from Christian County, and I work with an organization called Man Up and Go. And we are our organization's based out of Tampa, Florida, and in Florida they had similar legislation to this past couple years ago, and so we've been the recipients of dollars from that program or from that bill to be able to provide fatherhood engagement specialists in the Pinellas and Hillsborough County area. And so I've been able to have the opportunity to see what that program has done in that area, to be able to work with fathers who are engaged with the system of care. So when their kids are in the foster care system, we have a fatherhood engagement specialist through referral that can walk alongside that dad in the reunification process. So one of the things that we see in helping dads reunify is not knowing how to navigate the system, because there are lots of services out there for mom, but not as much for dad. And so this is a bioadvocacy type piece that would allow somebody to come along and help that dad navigate the system and help the reunification rate shorten, because a lot of times it can take a very long time just because things are prolonged and dad may miss a meeting because he didn't know it was supposed to be happening, whereas having somebody that comes alongside of them to help them through that process can help expedite it and help that dad be in a healthier place to, when that reunification happens, to be a better dad in that situation. But also I love what they're doing, because that is a preventative measure that they're doing at Resource Health. We do that at Pregnancy Care Center in Springfield. We have a fatherhood program there as well. That is a preventative measure to say, let's help keep dad engaged, and bringing somebody alongside of a person that didn't have a father figure growing up to help them understand what this looks like is a benefit to them. And it allows kids to stay together with their dads and keep the dads engaged in that kid's life.
Thank you. Thank you for your testimony. Any questions for the witness? Seeing none, appreciate your time.
Awesome. Thank you.
Next in favor.
Thank you, Madam Chairwoman, and members of the committee. Samuel Lee, registered lobbyist with Campaign Life Missouri, to go on record in support of House Bill 1948. Some excellent testimony this morning on this legislation. Very grateful that you've filed this and got this moving again. I would just add that CareNet, which is a national pro-life organization that has 1,200 affiliate pregnancy centers and maternity homes, did a survey in 2021 of about 1,000 men who were involved with an abortion decision for their wife or girlfriend. And the survey discovered, and it's consistent with earlier surveys, that the largest single influence in her decision whether or not to have an abortion was not her health care provider, was not her mother, was not a friend. It was the father of the child, whether they were married or not. And he is the biggest influence. Unfortunately, many of them are encouraging, in fact, in some cases, forcing them to have abortions. We need programs, more fatherhood programs, to deal with those circumstances. And I'm grateful for the pregnancy centers in Missouri that have stepped up and do have fatherhood programs. Happy to answer any questions.
Just super curious, how many of those fathers didn't have fathers or engaged fathers in their lives, right?
Yeah.
What
yeah.
the generational impact
Exactly.
has been. So
Yep.
appreciate that. All right, any questions for the witness? Seeing none, appreciate your time. Next in favor.
Well, good morning, Madam Chair, Committee. I'm Dr. Guillermo Villatrueva for the Missouri Catholic Conference, and we would like to go on the record in support of this bill. This is a great bill. We were in favor last year. We were in favor in the House, and I think that the statistics that Representative Gragg mentioned before, they're very powerful, and that previous witness have already covered everything that we had to say. So I would just urge you to vote yes on this great bill, because we do believe that it's going to make a difference in the lives of a lot of fathers that just want to be responsible and want to reunite with their family. So that's it. And if you have any questions, I'll be glad to take them.
Appreciate it. Any questions for the witness? Seeing none,
Thank you.
appreciate your time. Anyone else to testify in favor?
Madam Chair, members of the committee, Sarah Schlemmer here on behalf of March Mediation. March Mediation is an organization that helps parents figure out a parenting plan whenever the parents are no longer together. It helps resolve disputes that may happen otherwise in front of the child or may lead to unclear parenting boundaries. And so we see this as a preventative measure and appreciate the bill sponsor for bringing the bill forward and like to go on record in support.
Appreciate it. Any questions for the witness? Seeing none. Thank you. Anyone else here to testify in favor of the bill? Anyone here to testify in opposition? Anyone here for informational purposes? All right, Representative, any closing comments?
I just thank you guys very much for the opportunity. Thank you very much.
Thank you. All right, that concludes the hearing for House Bill 1948. We're going to now move to House Bill 1696. What? Okay. Left. I didn't see him walk back in.
Thank you, members of the committee. Thank you, Chairman Carter, for allowing me to present HB 1696. This bill does a few things, so I'm going to go over what it does and then the reason why we have this piece of legislation that I wrote. So what this allows is if a court-appointed guardian of a minor would suddenly pass away, the court-appointed guardian would have the right of sepulcher. What that means is during the death proceedings, they get to decide where the child would be buried. There's a few things that we've included in here. During the court-appointed guardianship, they would have to do that during the court proceedings, just to make sure that's very clear. The court-appointed guardian also can opt out. That has to be done during the court proceedings. If they would opt out, it would just go back to the way that it originally is in statute, which is going back to next of kin. It also has it to where if for some reason the court-appointed guardian is being criminally investigated, they do not get to be the next of kin. It reverts back to the way the original law states. We also put in there at the very end a religious, cultural, and family and individual beliefs. I know a lot of individuals that do not believe in cremation, and so I just want to make sure when we're going through this very difficult time that the religious views of the individual are being upheld. The reason I wrote this bill over a year ago, actually, I think a year and like a week, my constituent and good friend she was the court-appointed guardian of her niece. Her niece parents abused her and her sister, and they had no rights to her, hadn't seen her in years. She ended up committing suicide. And when they were about to bury her, the father that came in that had done terrible harm to her and her sister actually was able to steal the body away. And her sister was not allowed to be a part of the burial proceedings because she had certain restrictions against the father that hurt her. So it was already a devastating time. And then this honestly made it even worse. They weren't even able to really do a funeral for Sawyer. And they weren't able to put her actually where all her family is. My constituent was the aunt of her. She loved her most, I would say more than her parents did. And so this bill was created to make sure that nobody else has to go through what my constituent and good friend had to. It's a hard time enough, but to make it even harder in these situations, I think we have a duty in the law to clarify and hopefully prevent another heartbreaking instance of that. With that, I'm really happy to take any questions.
I appreciate the intent of the bill. This is one, and the story behind it is something that you were kind of watching in the House, so I appreciate your advocacy in this behalf. Senator Lewis.
Good morning. I appreciate this story too because I was curious of where this came from. So thank you for the backstory, and I also wanted to publicly say congratulations.
Oh, thank you, Senator. My constituent would be here, but it's an 8-hour round trip. They did come to the House, so it's a long ways where they're from, so they were very gracious to let me talk about Sawyer. So I just want to mention that too. Thank you.
All right, any other questions for the representative? All right, seeing none. Anyone else? Anyone here to testify in favor of this bill? Anyone here for informational purposes? Anyone here to testify in opposition? All right, representative. All right, thank you. That concludes the hearing for House Bill 1696. We'll now go to Senator Gregory with Senate Bill 1137.
Thank you, Senator and Chairman, members of the committee, David Gregory, St. Louis County, 15. Before you, Senate Bill 1137. What this bill seeks to do is to prevent an unauthorized person from retrieving birth and death certificates. So very simply put, in Missouri, we're one of the only states that allow anyone, and I mean anyone, to come get your birth certificate or a death certificate. Anybody. They just have to ask for it, which of course is very dangerous, especially these days. And now our Department of Health is seeing massive requests from things like Ancestry.com and all kinds of odd and even foreign requests for these types of things. So, you wonder how dead people are voting. Well, this is one very easy way to get death records, cross-reference them to a Social Security number, and all of a sudden you've got somebody who can never, ever defend themselves because they are no longer alive. So what this bill does is it just removes this one sentence that allows anyone to get it, and instead it's only authorized people, family members, next of kin, things like that. So with that, I'll take any questions.
Awesome. Any questions for the senator? Seeing none, appreciate your time. Anyone here to testify in favor of the bill?
Good morning, Madam Chair. Good morning, members of the committee. My name is Cade Tremaine, here this morning on behalf of the Missouri Department of Health and Senior Services, testifying in support of the bill. So as the senator has already mentioned, there is currently no protections for these highly sensitive data sets that Department of Health and Senior Services has for these vital records. So requesters can request any specific sort of date. So for example, a few years back, DHSS received a request to provide a listing of all births and deaths on each day for the last 106 years. So we are trying to avoid that as much as possible. We don't want this highly sensitive information to be put out on the internet, because that is something that can be abused. It can also be combined with other data sets that somebody would be able to purchase elsewhere. So that is essentially the issue that we're facing. This is with no considerations to families of the records that they are entitled to. And like I said, we don't want it to be in the public sphere overall. So overall, we view the bill to largely be identity protection as it pertains to public health, as the Bureau of Vital Records lives within DHSS. So with that, I'm happy to take any questions.
All right, appreciate your testimony. Any questions? Senator Lewis?
Just a brief question. And I totally understand what the point of the bill. We've heard this several years, but I just thought of something. There's been some discussion of over the years of dead people voting. Like, how would you coordinate with the Secretary of State, or to ensure that maybe dead people aren't voting?
So I think that does bring up a really good point of who is able to access this now. There are specific statutes in place that somebody like a coroner might rely on in order to obtain a death certificate, things like that. This would more so just make it to where nobody overall would be able to obtain a record unless you had a specific statute saying that you could, essentially, if that answers your question.
Yeah, thanks.
All right, any other questions for the witness? Seeing none, thank you for your
Thank you.
testimony. Anyone else here to testify in favor of the bill? All right, anyone here to testify in opposition? Anyone here for informational purposes? All right, Senator, that concludes.
Thank you so
All right, thank you. That concludes the hearing for Senate Bill 1137. With that, I make a motion that we go to executive session. Can I get a second? Thank you. All right, I make a motion that we go into executive session for Senate Bill 1069. Can I get a second? Second. Senate Bill 1069, this relates to limits on selling or purchasing certain drugs, is now before the body. Can I get a second? Second. Senate Bill 1069 is before the body. There is a sub-ending in .02C. Is there any discussion? All right, seeing none. I move to adopt Senate Committee Substitute for Senate Bill 1069. Can I get a second? Second. Thank you. All in favor?
Aye.
Thank you. I move to do pass Senate Committee Substitute Senate Bill 1069. Can I get a second? Second. Secretary, call the roll.
Senator Hudson?
Aye.
Senator Nicola? Senator Nuremberg? Senator Lewis? Senator Carter?
Aye.
Vote of 5-0.
With your vote of 5-0, Senate Bill 1069 is due pass. I now make a motion that we go to Senate Bill 861 related to gender transition procedures is before the body. Can I get a second?
Second.
Thank you. Senate Bill 861 is before the body. Is there any discussion? All right. I move to do pass Senate Bill 861. Can I get a second?
Second.
Secretary, call the roll.
Senator Hudson.
Aye.
Senator Nicola.
Aye.
Senator Nuremberg. Senator Lewis. Senator Carter.
Aye.
Vote of 3-2.
With your vote of 3-2, Senate Bill 861 is due pass. I now make a motion to bring House Committee Substitute for House Bill 1033 related to gender transition procedures before the body. Can I get a second?
Second.
Thank you. House Committee Substitute for House Bill 1033 is before the body. Is there any discussion? Oh, thank you. For clarification, this is House Committee Substitute House Bill 2033. Thank you. I've moved to do pass House Committee Substitute for House Bill 1033. Can I get a second?
Second.
Secretary, please call the roll. The second time. We'll just start over. I make a motion to bring House Committee Substitute for House Bill 2033 before the body. Can I get a second?
Second.
Thank you. House Committee Substitute for House Bill 2033 is before the body. Is there any discussion? I move to do pass House Committee Substitute for House Bill 2033. Can I get it? I'm having a hard day
You're on
today.
right, yeah.
Can I get a second?
Second.
Secretary, call the roll.
There we go.
You forgot
Oh, jeez.
Senator Hudson.
Aye.
Senator Nicola.
Aye.
Senator Nuremberg. Senator Lewis. Senator Carter.
Yes.
Vote of 3-2.
With your vote of 3-2, House Committee Substitute for House Bill 2033 is due pass. I now make a motion that we move to House Committee Substitute for House Bill 1667 and 2294. Can I get a second?
Second.
Thank you. House Committee Substitute for House Bill 1667 and 2294 related to abortion is before the body. Can I get a second?
Second.
Thank you. House Committee Substitute for House Bill 1667 and 2294 is before the body. Is there any discussion? Thank you. I move to do pass House Committee Substitute for House Bill 1667 and 2294. Can I get a second?
Second.
Secretary, call the roll.
Senator Hudson.
Aye.
Senator Nicola.
Aye.
Senator Lewis. Senator Nuremberg. Senator Carter.
Yes.
Vote of 3-2.
By your vote of 3-2, House Committee Substitute for House Bill 1667 and 2294 is due pass. I now make a motion to bring Senate Bill 1536 before the body. This is related, can I get a second?
Second.
Thank you. This is related to the appointment of a designated healthcare decision maker. It is now before the body. Can I get a second?
Second.
Senate Bill 1536 is before the body. It's not just me. There is a Senate Committee Substitute ending in .02C. Is there any discussion? Senator Lewis?
Thank you. I do support the spirit of the bill. The senator and I, due to scheduling conflicts, haven't been able to connect and work out some of my concerns. So I think we'll get there, but the sub doesn't address my concerns.
All right, thank you, Senator Lewis. I move to adopt Senate Committee Substitute for Senate Bill 1536. Can I get a second?
Second.
All in favor? Aye.
Aye.
I move to do pass Senate Committee Substitute for Senate Bill 1536. Can I get a second? Thank you. Secretary, call the roll.
Senator Hudson.
Aye.
Senator Nicola.
Aye.
Senator Nuremberg. Senator Lewis.
No.
Senator Carter.
Aye.
Vote of 4-1.
With your vote of 4-1, Senate Bill 1536 is due pass. That concludes executive session. Can I make a motion that we exit executive session? Thank you. That concludes the hearing for Family, Seniors, and Health. Can I get a second
Second.
to adjourn? Thank you. We are adjourned.